Hello, my name is Adam Riedel. This is my BSN346 prenatal precautions patient education video. I'm going to be going over a few things to be avoiding and to be looking out for during pregnancy. So first things first, you're going to want to kind of educate on a couple foods to avoid during pregnancy. The big ones are going to be raw meats, things such as raw pork, raw ground beef. Sushi is a big one that you want to avoid those because they might have potential toxoplasmosis or salmonella. Things that are high in mercury are also something that you're going to want to avoid. Tuna is going to be sparingly okay because canned tuna doesn't really contain that much mercury, but things like swordfish, shark, tilefish, I believe, is another one that are high containing in mercury. You're going to want to avoid things like that. Sadly, one that's a bummer is soft cheeses, things like gorgonzola, brie, Mexican type cheeses such as like quesos or things of that nature are going to be things that you're not going to want to you're not going to want to have. You're going to want to avoid those. Some good foods to have are going to be, fruits and vegetables, cooked meats, things of that nature. Lean meats specifically, so like turkeys. In that regard, leaner proteins, and then obviously drinking water, keeping yourself really, really hydrated. You're also going to want to go over some over-the-counter medications that they can take, and overarching for any real medications that you're going to be taking during pregnancy, you're going to always want to talk to the provider and the pharmacist first before taking anything that includes anything over-the-counter. But something that is more safe for over-the-counter use is going to be Tylenol. That's not going to be as harmful as something like ibuprofen is to the unborn child's kidneys, just because they're not as developed. There's not as much metabolism that's going to be going on there, so it's going to be potentially more harmful for them. So you're going to want to avoid that. You're also going to want to avoid natural medicines, things of that nature, like supplements, vitamins, herbal alternative medicines or things like that. Even though they're natural, they're not necessarily going to be the safest things for you. So you're going to want to consult your doctor before you're taking anything of that nature. Another thing that you're going to want to also talk about is environmental exposures, certain environmental exposures you're going to want to look out for. The big one is going to be secondhand smoke. Secondhand smoke is going to be just in general bad for you even if you're not pregnant, but there are a lot of chemicals within secondhand smoke that you're going to want to avoid that can potentially be harmful to the baby. That can even lead to potential miscarriage if you're exposed enough, or sudden infant death syndrome as well. Something like cat litter is another thing that can contain toxoplasmosis. It's not going to be as common as getting it ingested like within food, but you still you want to avoid handling cat feces and just avoiding that altogether, just because that's going to potentially be another way that you can get toxoplasmosis into your system. And another thing too, which is avoid lead-based paints. So if you're excited about having a child and you're wanting to get the room ready, do not be the one that's painting that, especially if it's going to be a lead-based paint that you're using. You want to avoid that because that can potentially have issues with fetal development. Another thing that you're going to want to also include in your education of precautions to this mother or these parents is going to be watching out for issues with alcohol ingestion, smoking, and then substance abuse. Obviously, all three of those things are things that you're going to want to totally avoid during pregnancy. Alcohol can potentially cause development, fetal alcohol syndrome, SIDS, brain defects, potential mental retardation, and then smoking as well. All of those can lead to potential issues with the unborn child. And then along with substance abuse, there can be a lot of neurological issues or physiological issues that child might have after the fact, or they might have potential heroin addictions coming out of the womb, and they might have withdrawal issues after the fact, after they are born. And those are things that you want to totally avoid during your pregnancy. For traveling, you want to obviously consult your doctor if you're going to be traveling anywhere, and always, I think importantly, is pre-plan if you are going to be traveling. So kind of have an emergency plan wherever you are. If there's a potential provider there, where the nearest hospital emergency room is, and just being very precautious for that when you're traveling. So past 36 weeks, that's going to be kind of avoided in terms of airplanes, and in general, just because you're so far along in the pregnancy. And then international, you want to kind of stop doing that from 28-ish weeks to like 32-ish weeks, kind of a range. That's something that obviously you and your provider are going to be discussing specifically. That's going to be specific per each female. And then, like I said, always pre-planning. With traveling, if it is a long plane ride or things like that, you want to avoid sitting for prolonged periods of time, and that's without just traveling. Avoid prolonged periods of sitting, because that can be a potential risk for developing a blood clot. So walking around is going to be really important, and then potential prophylactic use of TED hose can be also very helpful to avoiding blood clots from even occurring. And then the last thing you want to kind of talk about is the usage of the dentist. It's actually encouraged to go to the dentist frequently to have cleanings still during your pregnancy and keeping your teeth healthy. However, you want to avoid potential prescribed medications from them, such as, like, importantly, tetracycline, because that could be very damaging to a developing baby. You do not want to be using that while you are pregnant. And then you obviously want to avoid any potential harmful radiation, such as like x-rays or things of that nature. So avoid those. Really just kind of, dental cleanings are the big things. And another thing too, which would be something that you would want to talk with dentists and then just kind of talk to your patient about as well, just to be kind of having them cognizant of, would be the potential increased erosion from the acid, from potential increased morning sickness that they might having. That can be very harmful for the enamel in your teeth, and it can erode that really quickly. So if they're having a lot of increased morning sickness, you want to make sure that they're cognizant of making sure that their mouth is brushed and they're not having that acid built up in their mouth. And obviously, if they had any questions about any of these things during my education, I would be happy to let them know or kind of explain any of that sort of thing. But for now, that is it, and thank you very much.